we leave the floor to you, Bhaswati. You've listened to the two panelists, you listened to some of the questions, you listened to what I had to offer, a few thoughts. And what you have promised us is a little more about your experiences with DINacharya, Ritucharya, in many parts of the world. You practice in New York, you practice in Paris, you are now in Udupi in the south of India, you did your PhD and you lived and worked in Varanasi at the Banaras Hindu University. So you have a lot of experience in how you understand modern medicine perspectives. You're a public health master's, you look at policy aspects. You recently published a wonderful paper on timing of food with a multi-author paper, which was quite amazing. We will circulate this to all who are registered, and maybe you can tell us a little more. And in there you highlight timing of food as a therapeutic intervention, which Ajith ji also mentioned. I don't know if many people are aware of the importance of when you eat. So you touch on so many things, but what I think what the audience would like to hear is how you have seen in your own practice in all these locations, recommendations like what Ajith ji says, you know, in 4 weeks' time, you can change a person's health, or what Martina says about health. Do tell us a little more about how you have seen in practice some of these interventions, how it benefits, and also if you can tell us a little bit more about where Ayurveda needs to go in terms of education, in terms of research, where we as the Ayurveda Valley, you would like to see us go. This would be wonderful. Thank you. The floor is all yours, Bhaswati.
Thank you so much. So one of the things that I have found in working in different places around the world is that people want to learn Ayurveda once they learn about its concepts, because of exactly what Martina and I discovered when we went to med school. I did not sign up for med school saying, I think I'd like to become a salesman or a prostitute to the pharmaceutical companies. Where should I get vocational training? I think I'll go to medical school. The reason that most of us went to medical school, whichever medical school it was, Ayurveda, homeopathy, Unani, Siddha, modern medicine, Soaripa, naturopathy, so many different kinds of medical schools. We all went because we wanted to help people. We wanted to help heal people. And as Martina and I are both modern medical doctors who have now learned Ayurveda, we both discovered that there was a lack of teaching us real, what they call science. Why? First of all, the science constantly changes. So I'm sure what Martina learned in med school was out of date by the time she got out of residency. What Dr. Ajith learned in medical school was only enhanced when he got out of medical school, and he just learned it deeper. The rules didn't change. For me, I also got out of medical school and everything started changing. And I started wondering, well, if I want to help heal people, why do the medicines keep changing? And something that's the medicine to go to, Vioxx, the best medicine as a painkiller, ends up being taken off the market because it's creating huge poisonous effects in people. So I'm going to blend some of my experiences and disappointments with modern medicine, because I do love many aspects of modern medicine, but I'm deeply disappointed that people are so blind within the field. And it makes me wonder, did you guys buy in to a different agenda than helping people? And I find that to be very common in many of my colleagues. So now we have the front drop. That's the backdrop. The front drop is COVID. So I started thinking all three of us were going to just talk for some time and then take questions. And I realized that many of the things that were being told would not be understood by my students because they are not spelled out. So I decided to put together some slides. So I'm going to, with your permission, Madan is not here. So Dr. Ajith, Dr. Martina, with your permission, I'm going to put some slides up. Yes, it's okay. Madan, can I take the screen? I guess that's a yes. So
all yours, Bhaswati.
yes,
Your screen is up.
thank you. Good. So I'll start at the beginning. So I decided, actually, I did this while Dr. Ajith was talking, and I just threw together some of my slides so that all of you can have a chance to see the words that he and Martina and I have been talking about. And I think we've tried to give you both practical hints and some deep foundational principles. So I'm going to focus on practical aspects, but I'm also going to put in some of the words that we've all been using in the COVID and the respiratory conversation. So I begin, and I'll tell you a little bit of my story as well, so that you can understand more of a context. So I found this on one of my chats. It's Immuno Bread, which has just come out. You can buy it. It says, on the label, the Ayush Ministry recommends immunity ingredients now in bread. And so it's got turmeric, ginger, clove, black pepper, cinnamon, cumin, and jaggery. And there's a happy smiling face at the bottom of the bread. So let us break bread together now and learn a little bit further about this. So obeisance to my gurus, my teachers, and to Dhanvantari, who is challenging us, but also keeping us safe in these times. So we've talked a bit about the context with Dr. Madan giving us an overview of COVID. And when people are living in fear, I have a lot of patients who are telling me they are so scared by what's going on. They can't sleep at night. They wake up with nightmares and tremors. Their family members are sick. We've had, various people in our lives who are either in the hospital or have gone through COVID. Some have died. And they say, everyone's getting it. So on one hand, are people saying, it's not a big deal, it's less virulent than influenza, why are you making a big deal of it? And they want everything open, they don't want to wear masks, and they're very, very cavalier about it. We know many of those people. They live in New York, they live in California, they live in Georgia, they live in the kinds of places where people are not taking care. And what's happening is that they are having huge risk and rates are going up. And we're tracking those. And I'm saying this as a US citizen that I love New York, but I also find that people sometimes take things not so serious. And we're going to talk a little bit about that toward the end. What I tell my patients and my students is, well, how is the high risk healthcare worker staying well? My friends go to work every day. They've been going to work every day since years, but definitely since February or March, and they are staying well. They're not getting sick. Some are getting sick, but most of them just go into work and they continue to stay well. Wouldn't it be nice to have that level of strength, of resistance to disease? So I do teaching within a group called Cultivating Self, which is a group of nurses around the United States. Most of them are in the San Francisco Bay Area. And they have started learning about cultivating their own health habits because they don't get time off from work. They have to go and take care of the patients who are COVID positive. And how do they do it and not die? So if people are all afraid of getting COVID, rather than taking the lessons of how to protect themselves, then they're not in their strongest way. So I'm going to teach you some of the things that we as healthcare workers have been learning. My main hospital is the epicenter of the largest number of COVID cases in the world. It's New York Presbyterian Hospital, NYP. And I did my residency at the Columbia University branch, and now I'm an assistant professor at the Cornell branch. And I go to grand rounds during the week via online seminar now, and I talk with my colleagues, and I get to hear from these private confidential chat groups the challenges that doctors have in what they don't know and what they're being forced to do. If they try to recommend anything that is Ayurvedic per se, they are not allowed. They are laughed at. And this is a big challenge that we have. It's a challenge that many of my patients bring to me because I have a lot of healthcare professionals also as my patients, and they'll say, well, I don't know how to do this because I can't let anyone know. I can't talk about it to my hospital administrator. But they have personal choices, and many of them have tried doing the hydroxychloroquine and the other things in modern medicine. They've come back and they are amazing. Well, obviously they're coming to me, so it's a selected biased group, but they say, I want to learn Ayurveda. I don't know any of the words. I don't know what kapha dosha is and why I should take tulsi to lower my kapha, or why I should take honey because it's got kashaya in it. What is a kashaya? What is that? But I want to do Ayurveda. And so I have this challenge of teaching allopathically minded people who are very much inculcated in modern medical way of looking at things to understand a very different way of looking at things and of looking at the world. And so that language is always a little bit different than the language that I use among Indians who have grown up with cultural take for granted recipes, or take for granted daily routines. And I have to start at a place where people wake up to an alarm clock that is their coffee machine that makes coffee next to their bed. They roll over while they're still in bed. They take their black coffee and they drink it, and that is how they wake up. And to them, that's a efficient multitasking routine. So going from that level to the level of Ayurveda is what I deal with many people in Europe and in America, the Americas, North and South. There are some questions that I also want to pose here. One is, what is the value of COVID testing, COVID positive or negative? And I'm posing this because many of the people that come to Ayurveda in India, I'm in Udupi, South India now, they don't want to be tested. And when I ask them, some of them say it's expensive, some of them say it's hard to get, but many of them say the tests aren't even that accurate. And as a doctor, I will tell you that there are many, many tests out there. We can ask the question later, and I'll tell you the story of why the CDC and the FDA have deregulated and allowed anyone to make any test they want. Some of them have 40% sensitivity. That means 4 out of 10 times that they would give a test, it's accurate. 6 out of 10 times it's not accurate. That's in the US. That's state to state in the US. It's different in the 50 states than it is in any other part of the world. So for Americans, it's going to be one way. In Italy, they have a different test. The WHO has a different test. Maybe Dr. Martina can tell us what it's like in Prague or in any other country where she's worked. In India, there's a different test. I'm sure in New Zealand and Australia, there's a different test. And I will tell you that in New York, there are many tests, and the doctors are now using 3 different tests to figure out whether they're accurate. So what do people default to? They default to their own body's rituals, their own body's clocks and understanding. Because if the test is going to be 4 out of 10 times correct and 6 out of 10 times not correct, I see Martina saying no. So I'm curious to see after this what if you could elaborate on it. So people are confused. They are angry, they are scared, they are poor because they're not working. Many of them have not learned how to save money, so they live hand to mouth, paycheck to paycheck, and they're waiting for a good test or they're waiting for a vaccine. And we have to think about the vaccine question as well. Please don't think that Ayurveda never thought about stoking the immune system. It did. And that is how it built up the Vyadik Shamatva, which was the concept that Dr. Martina talked about. So mental health, as I prepare people, which is the first stage of getting ready, is in understanding some facts of what they've learned from the modern world, but also in understanding that we are not in control. And that's something that no one has said yet here, but I think we all assume it, that you know that. You think you're in control. I think, oh, I put myself through medical school. There were thousands of people that were responsible for me going to medical school, including some people who didn't accept the invitation at my medical school so that they came down the list and chose me, including the nurses who helped me to learn the techniques, including the doctors who chose to come to school every day and teach us, including my classmates who helped me to learn all the things I learned. There's an entire web of all of us together. And that collective moves slowly, sometimes quickly, but with us as a part of it. We are an inextricable, minute, and hopelessly minuscule, but important and essential part of that. And we are not in control. If you let go of the control and you realize that all you can do is protect the circles around you, then that is the first stage of mental health, because you're not trying to take on the entire world. So Ojas is about building the robustness that you have. We talk about ghee and that glow that we have to us. Attractiveness is one of the main features that they talk about as a indicator of Ojas. Why would you want to be attractive? Because when you have relationships around you, those are ultimately the people that help you. You cannot get food unless you grow it yourself, or you have a bunch of people that help produce that loaf of bread that was on the front page, right? All those spices, how many people produced? All those wheat, the plastic, the baking, everything. So if you think of yourself as part of a web, you will actually let go of the control that allows you to get a little bit more solid and let go of some of that fear and anxiety. When the Ojas builds up in you, you will not have as much vulnerability to disease. And Ayurveda says that 90% of the time when you get sick, it starts either in your gut by something you've eaten because of prajna parad, bad decisions or mistaken decisions, or something in your head where you're fearing or having anxiety, which is also sometimes bad decisions. So the mind and the gut are creating 90% of your diseases. So get your mind in order. If you're not doing yoga every day, you should be. Yoga is not just hatha yoga, where you sit, right, in a position, or you stand, or you do the physical part of yoga as we understand the physical yoga, so they call it. Hatha yoga is one aspect, and it's what we see in the demonstrative postures. But hatha yoga is just one part. The other parts are doing good work, which is karma yoga. Breath work, which we've already talked about, which is pranayama. Understanding the right and the wrong, the good and the worthy things that your conscience thinks you should do, which is the yamas and niyamas. Learning all of that together brings you to a place where you're swa, self, asta, settled in yourself. And swasta together means health, but swa asta means sitting in yourself. The mind must be linked with the body. As people in the West find that out, they are moving toward yoga. Yoga is a $16 billion industry in the United States alone. There are over 75 million people who report that they've done yoga in the last 6 months. This is an old study from the Yoga Journal, actually about 5 years old. But it says that people are doing yoga because they don't like being disconnected. And they know that there's something that happens in their health when they are connected. COVID is asking us to get connected again so that we are not paralyzed by our fear. When people say they do Ayurveda, it's very important that you understand that just taking Tulsi is not doing Ayurveda. Ayurveda depends on you understanding the philosophy of dosha, srotas, and gunas. At least, these are just some of the basic terms, but they kind of envelop the understanding. If you take Tulsi and you just drop it in and you're on the run and you don't know what you're having, then the Tulsi will have a chemical effect, but it will not be able to take the other levels of effect that are important. Ayurveda works not just by chemical. Ayurveda works by a deeper level. Now, I wonder if I got, oh no, I didn't get cut. So Ayurveda talks about axiomatic scales of perception. Now, this is a pretty subtle concept, but I'm going to make it very easy for you. Ayurveda says that, well, okay, I'll back up to the mainstream world. The mainstream world says we know things from a very, very small size, nanometers, which is 10 to the minus 9, up to meters, which is 10 to the 1, 10 to the 0, or 10 to the 1. And we can go up to meters and say, okay, this is what I see. We can go down to nanometers using microscopes and say, okay, this is what I can perceive. But that's it. Ayurveda, on the other hand, went all the way from yoctometers, which is 10 to the minus 24, all the way up to yottameters, which is 10 to the plus 24. They have a much wider scale in their frame of reference. And because the science incorporates the entire breadth of, so this is 48 logarithmic numbers, one second, that allows them to understand very large things that are going on. So you see the picture of Jupiter at the bottom. The diameter of Jupiter is actually quite small compared to 10 to the 24th. It's only 10 to the 11th. And it understands energy and subtle energies, which are beyond the size of a mole, which is, Avogadro's number talks about 10 to the minus 23 particles. So we go to 10 to the minus 24. So the most subtle ways of understanding the world, which is beyond particles, which is actually waves, is now being discovered by modern physics and postmodern physics and various quantum theorists. But it was already understood 5,000 years ago, before the Stephen Hawkings and before the people who have discovered things now. It was understood. And so when you follow Ayurveda, not only are you following these concepts of gunas and shrotas and doshas, which have already seamlessly integrated every science of modern medicine and modern understanding, but you're looking at something that's not only translated the sciences from astronomy down to the most subtle levels of botany and nanomedicine, but it's taken all of it and said, how does it apply to us? How does it apply to us as a member of the ecosystem, which is actually very scary that we can manipulate things to the level we can because of our consciousness, because of our chetana. So how do we live a good life, but also understand things and understand ourselves in a context? So we are all in different parts of the world. We are not in the same place. When we learn Ritucharya, which is the study of the cycles, it's mistranslated. We have a big problem of Sanskrit to English translation. It's mistranslated as the seasonal routines because people think that Ritu means seasons. And we've gotten into this many times, problems because students don't understand that the word Ritu actually means cycles. There are three main cycles according to astronomy that we understand. One is the day-night cycle. So as the earth is spinning, the spinning creates day-night, day-night. And we get a cooling effect at night where the moon's influence is more prominent on us for 27 of the days of the month. And we get the other, let's say 12 hours or less or more, we get the sun's influence. So that's one of the cycles, and that determines our DINacharya. But it's not really about the sun and it's not really about the heat and the cold only. It's about the sun and the moon and the subtle influences as well. And so you have people that are living life not based on Sunday, Saturday as the weekend, but based on the lunar calendar. So if you go to Sampurnanand University in Benares, they don't get Sundays off. They get Amavasya, which is the new moon, and Purnima, which is the full moon, and the days after that, which is called Pratipada. So those are the days that they get holiday, because those are the days that they should wake up and do extra time in meditation. So that day-night cycle was already understood. They say that Benares, which is called Kashi, is older than the Ganga itself. Think about how old that is. And when they say that, I know that Mark Twain said it, and he's not that old, but when they say it, if you think about it, and then you go and do some paleogeology or paleoarchaeogeology, you'll understand that actually before the Himalayas were formed, India was an island that was kind of attached to, you know, this whole glob of mass, and it actually traveled up through the Tethys Sea and crashed into what was previously Asia. It's called Laurasia, and created the Himalayas. So India actually did exist 25 million years ago, 50 million years ago. Was there any life? Was there a man at that time? We don't know. These are all questions that are in the mythology. But when they talk about Kashi, they say how old it is and how the Ganga has this sacred influence. And the things that they know from the oldest times are what they still follow in this timeless ancient city. And they look at the day-night cycle as sacred. The second cycle is the lunar cycle, which I already mentioned, which is the moon moving around the earth, and it creates fortnight cycles. So you have the day-night cycle that calls DINacharya, and you have the fortnight cycles of what we call the tithis. And there isn't really an English translation other than fortnight. And fortnight is thought of as a British word. It's not really used in American English or in many other languages. The third cycle is the solar, which is the earth moving around the sun, and we come back to the same place. And so that creates what we call the seasons. But there are only there are different seasons in different parts of the world. And this is a big problem that we had in our DINacharya classes, because we have people from all over the world. We have people from Australia and Singapore and the Philippines and China, so the eastern part of Asia. We have many people from India, and then we have people from Europe, South America, and North America. And they're all saying, well, it's not like that here for me because I'm in the Southern Hemisphere. So why are you saying the names of these seasons that May, June are or April, May, June are the summer months? And someone in Europe will say no. So understanding that when you get recommendations on a practical level, that you have to understand the translations more accurately, it's really important. Otherwise you'll get confused. So I'll just take you through step one of it, and then we can have some questions if you'd like. Grishma is called summer. And these posters are by resanskrit.com. They make beautiful posters. They have them for all the seasons. So I put Grishma in the center because for the people in the Northern Hemisphere, it's Grishma. I put the Hemant and Shishir in the side there for Dr. Ajith because he's in the Southern Hemisphere. And when someone says to him that Grishma is mid-May to mid-July, which is what it says on the poster, it doesn't work for him. Because as far as I know, Dr. Ajith, it's not actually summer there for you, right? So if we understand what Ayurveda actually taught us in Sanskrit, what they said is the Adana Kala is the time from one solstice to another where the sun is moving from the most northern place in the Northern Hemisphere to the most southern place, and the opposite in the Southern Hemisphere. So when the Adana Kala is there, the sun starts getting stronger and stronger and stronger. So for us in the Northern Hemisphere, it's from the winter solstice to the summer solstice. And during that time, the sun and the increasing amount of sunlight or time of the day, it grows by 1 to 2 minutes or so a day up until the next solstice. During that time, the sun is sucking out its adane, it's to eat or to suck out energy. This is my Sanskrit teacher who really put this into us, that it's about taking energy out of you. When COVID started affecting us, it actually started increasing right as Adana Kala started. When our energy actually starts decreasing on a subtle energy level, that is when this whole crisis started. Grishma is that time that steals your energy. It's the hottest time. And so if you understand this, I'm giving this to you as an example so that when you read Ritucharya and you read some of these English translations or French translations or German translations, you will know that you should not see that this is a summer recipe, which means summer, unless it is a time of the heat. So if you can read this poster, it says the loss of moisture, the high intense sunlight. And that is what you should be focusing on. Maybe you can see that really big right there. The loss of moisture and the high intense sunlight. So this is one of the basic principles of understanding Ritucharya. And once we establish this, then we move forward and we start layering in what are the gunas. So you see on the right side, these gunas. And there are only 3 that you need to work with if you're a beginner. That will take care of about 80% of all the recommendations we give you. You need to figure out if you're in a hot or cold part of the world, a moist or dry part of the world, and whether or not things are very heavy around you, like a lot of moisture in the sky or in the air, or if it's very light, like windy and air around you. These correspond to the elements which we have already at least referred to, and we didn't talk about them in detail, but we did. The air and the ethers are very light. The fire is in the middle, and it separates the very light from the very heavy, which are water and earth. And this is the doshas. This is how the doshas are separated. And so if you see what's happening in your part of the world right now without following the labels of English, you'll see that there are certain routines that you should naturally follow. If it's very heavy there, eat foods that are lighter. If it's very humid there and very heavy, then go for things that are easy to digest. If it's very stagnant there because of the heaviness, go for lighter exercise. And the opposite is true. So we'll just stop there and move forward a bit, because I'm sure we'll have some question time for this. There are herbs to use. So the herbs that we should use are not just the herbs. The herbs to use that are tulsi, guduchi, and ginger are taken from a survey. Actually, Madan and I are part of a COVID Ayurveda clinical research working group, and we did a survey. It was the first survey in India in the middle of March when Ayurveda was illegal to be practiced. And so we asked physicians of all types, all kinds of healthcare workers, if they were to encounter COVID, if it were to come into India, then in March, what would they do? Would they take any Ayurvedic medicines? 81% said they were already taking, or they would take it, even though it was illegal. Then we asked, what would you take? And they said tulsi, guduchi, and ginger. This is 1,800 physicians in one 24-hour period that answered. So as soon as they answered, the pharmacies started working. So two different groups. There's a lot of groups. I just took two of them that are well known. So Baba Ramdev came up with the Corona kit. They have tested 200 patients. They found that those patients did much better than the control group. And so ethically, as is done in all clinical trials, when one group does significantly better than another, then you should unblind the trial and give that medicine and make it available to everyone, especially if there's fatality involved. So they released it. There's a lot of hoopla about it. Another company, about a week before, had planned to release right around the same time, and they've released their immunity kit. And so they've also got components to it. Why are there components? Why don't they make it one pill, one-stop shopping? Because as Henry Wellcome had made one pill available and said, this will make life easier for you, if it's not accurate, what's the purpose in making it easy? Some of you do need guduchi. Some of you shouldn't be taking guduchi. Actually, almost everyone should be taking guduchi. Some of you can take amla. Some of you can't get fresh amla. So they've made a juice for you. Some of you have access to certain herbs in liquid form, which is great. Some of you can only get it in powder form, depending on where you are around the world. So there are different formulations being made, and you're being encouraged to take them. And Dr. Ajith gave some excellent recipes. He gave practical recipes. He's been using them with patients. We've also here in Karnataka seen patients. I'll talk about some of the things we are doing. Dr. Martina also talked about it. How do we get this information out to people? So one of the first columns I wrote in March was the why of ancestral wisdom, because I was trying to help get the Indian government to stop having Ayurveda be illegal. And this was a big deal to those of us who really want the right of Ayurveda. One of the reasons I don't live in New York full time, and I love New York, one of the reasons is because I am terrified of the bullying in the healthcare system in America. They will force you to do things, and it's very expensive. There was a report yesterday that a man spent 62 days in the hospital because he had COVID and he was sick, and it took him some extra time to recover. He has a $1.2 million hospital bill. Who is going to pay that? Is he ever going to have health again if he's constantly in poverty? And who's going to forgive that debt? So in America, it's very hard. People are always complaining that modern medicine versus Ayurvedic medicine, how the budget is so much more for modern medicine. If I can go outside and pick a coconut and that's free, then the cost to me of maintaining my health in the ecosystem that I'm in is much cheaper than using products from a system where I'm constantly having to put energy and input and pharmaceutical chemistry and regulations and checks and balances and toxicity studies to make that medicine available, which is also effective, but is not good for the ecosystem. 1 year ago, people were talking about Greta and the environment. Do the people that are throwing away their disposable PPEs, their plastic bags, and their various protective gear think about the cost on the environment? No. I will tell you no, because I see how much plastic there is outside right now being tossed away. Where is the thought of the ecosystem? So I decided that one of the things I could do, because I was stuck in, I'll say I was stuck at that time. At this point, it's a voluntary choice to be here. I have recently finished a mid-career PhD in Ayurveda, and I have started a postdoctoral period where I'm learning Ayurveda from some of the deep healers, authentic healers here in Karnataka. And I didn't know how to participate in the US healthcare system as a licensed physician. So I decided to start writing for a newspaper who invited me to write a column. So I welcome you guys, since I'm not going to have time to talk about each of the things I've written about, but weekly since March, I've been writing about practical ways for people in all parts of the West to be able to partake in Ayurvedic wisdom. So this column I featured is the why of ancestral wisdom. And again, Dr. Martina and Dr. Ajith have highlighted most of the things I've said in this column. Why bitters in the nose? Because it increases your mucociliary epithelium. There are cells that create a mucus layer that prevent COVID from, any bug actually, from coming in. They have cilia, which are hairs that constantly push out anything invasive that shouldn't be in your nose or in your sinuses. To get those cells to stand up and do more work, you just have to put bitters in there. So the nasal oil that Dr. Ajith demonstrated is a perfect way to line your sinuses with those bitters. If you want to read more, you can find it in this column. I think I even put the reference in there, and you can click on it and get it. The protective layer, the scraping the tongue and getting rid of the residue or even the toxins, the hot water in the morning to melt down that phlegmish, that heaviness, that mucus layer, and get it into the stomach where there are acids that are just going to digest it. There are many of us that feel that COVID is not a virus that is affecting the respiratory system first. We feel that it's affecting the amashaya, which is another word for the upper part of the stomach, where the toxins first come in and are encountered by the body, where the body has a huge immune system that can process it. If your stomach is not healthy, then that virus can seep its way into the body through a process called pinocytosis, which is where the cells take it in. They don't process it properly because your fire, that word was jataragni, the main fire in your gut, that will not be strong enough to kill the virus, and it will make its way into the respiratory system, either through the lymph, through the blood, or across. And we feel that that's actually what's happening, but we can't prove it because we don't have labs. We just have clinical people to try things on. We don't have the proof. And so we'd get laughed at if we said, no, it's actually in the stomach and not in the respiratory system. And yet the data that Dr. Madan just showed points to that. The immune system in Kada is another word for quath or decoction. That's another thing that I've been encouraging all my patients to take, especially the ones that have been calling me from different parts of the world and saying, what can I do? We talked about many of these herbs. The one that I didn't hear mentioned is Yashti Madhu, which is a demulcent and is very good for liquidating phlegm. It's not for everyone when it's in its purified form because it can increase blood pressure. But if you get the sticks, which are part of an ecosystem of a plant, and you just cut some of the stick and smash it and just put it into your tea and take it out, the essence of what comes in that, it's called Yashti Madhu or licorice, is actually very effective for the phlegm. But we don't use it as a preventive. We use it for people who have allergies. We use it for people who have phlegm in their nasal area already. And we use it for people who have mild to moderate upper respiratory disease going on. So we tailor it. We talked about keeping the gut clean. We talked about sleep and emotions. In another column, I talked about fumigation. So this is done daily in houses all around Udupi. And there are many components to it. If you've ever seen it, it happens at sunrise and sunset. The short form of it is to take incense and put it all around the room, and you'll see that it goes into every corner, and someone will wake up in the morning and have incense. These days we get wonderful flavors like vanilla and chocolate rose and things, but it's not supposed to be that way. It's supposed to be made spices that have antimicrobial properties. So you'll see that people will actually take cones or incense sticks, or they will take an earthen pot or a coconut shell. They'll put into it something moist at the bottom, sometimes antimicrobial neem leaves or If you're in the West, cedar is very popular. Sage is very popular. Lavender, juniper. Some of the Western herbs are very effective. Eucalyptus was mentioned before. We put in some kind of local wood. We put in something antimicrobial like turmeric. Sometimes if you don't have any of those things around, like people were having in March, you can put in onions, pieces of onions. You can take the skin from garlic. It does make it more pungent when you burn it, but that kills bugs. Some aromatic spices such as fennel, or you can use basil or rosemary or thyme. These are Western spices. And then so that the fumigation is not this dry, smoky heat and smoke that's going to irritate the throat, we want enough moisture. So we put a couple of drops of some kind of plant oil or ghee. And then we light it on fire and a smoke emerges and we take it around. In India, we use gugulu, which is a resin. We also use a variety of powders that are locally available. Why? Because as they burn and they go and spread themselves back into the ecosystem, they create balance as they had been when they were growing in that area. In Benares, there is a whole Brahmin culture of what we call Uchista, or many of the Hindi speakers know it as Juta. In Bengal, I'm Bengali, we call it Eto. It is a concept that is very hard to explain to non-Indians. Anyone that marries someone who is a non-Indian has a problem of explaining to their spouse why it is that they can have sex with their spouse, but they can't drink water out of the same cup, or they can't use the same toothbrush, or they can't go through certain rituals. Because Uchista teaches us actually the best of what the OSHA guidelines and a good microbiology lab, like the one that Madan worked in when he was doing his PhD in genomics, or I was working on my PhD in pharmacology, these culture labs that are very, very sterile and clean, or some of the hospital surgical suites. They teach us regulations on how to keep clean. It's not just sanitary guidelines, it's a set of super hygiene guidelines. And these are already known and used in all the JACO, which is the hospital organizational guidelines. But before they came out with it, the idea of Uchista was there. And so we don't have any cases of COVID here in Udupi, in this local area, for about 50 kilometers around. And I was trying to understand why. And so I was talking with some of the doctors here, and we were saying, well, we all follow Uchista. We don't actually drink out of each other's cups. We don't use each other's towels. We don't have certain practices that are considered to be normal in the West. And it's something worth learning. So you can read about this column that I've written. Madan, can you give me a time check? I actually didn't check what time I started. You are on mute, as usual.
Bhaswati, if you can draw to a close.
Yes, I will.
Then we'll have time for a few.
I will. I just realized what time it is, and I apologize. I apologize. So I'll finish up very quickly. So The Emperor's New Clothes is a storybook that you'd read. It was by Hans Christian Andersen, and it was a story about deception. And the reason I bring this up is because I honestly believe that modern medicine has a certain role of deception that it's playing, trying to pretend that it's the emperor because it's the mainstream medical system that everyone accepts. We have seen failures. They failed with the ventilators. They failed with the hydroxychloroquine. They failed with PPE and providing them to their own workers. So many of my colleagues were affected by PPE being unavailable or not being given to them because the hospital administrators have contracts with their friends and secret under the table commissions. We know about the corruptions. And yet, despite the biotechnology and pharmaceutical and hospital groups working together, they act like they're in charge. And it's time that the Ayush systems come and create a grassroots movement of people reprioritizing our health. We either have to decide that human health is a fundamental right, or we have to decide that it's a capitalist system and everyone should pay for it, which means if I have money and access, I get better healthcare than you do and you don't deserve it. And in Italy, when they had to decide who was going to die, we learned about it. We learned about the reality of it. And so The Emperor's New Clothes is a very short storybook that all of you should read and think about what the implications are. I'll leave it at that. This is where I want to spend most of my time for the remaining moments. In India, what we are doing is using a set of medicines, which are probably the most potent and most effective medicines, but not everyone has a right to them because of the way laws are set up. They are called bhasmas and rasa oshadhis. They are metallic and mineral-based preparations. This is actually what my PhD work was in the Department of Rasa Shastra. Rasa Shastra is the study of these medicines and how they're made and how they are clinically used. The man in the picture is one of my teachers. He is Dr. Gopi Krishna Madikera. He's a brilliant maker of bhasmas and teacher of bhasmas and clinical user of bhasmas. And this is his formulation that you see in the screen here. You cannot get access to all of these medicines in all parts of the world. But in India, when people get sick, they don't go get COVID tested. What we are doing is we are taking these medicines. And on the first step, the initially giving part is herbometallic medicine that actually fortifies your hemoglobin. It's got bhasma, it's got bhasmas in it that are fortifying your hemoglobin, so that as we are learning about COVID and the fact that it might not be working on the lung, it might be working on the protoporphyrin and the porphyrin molecule, which is part of hemoglobin, and they're learning the biochemistry, they're actually coming to the place where we're learning that you need to protect the red blood cell, and the lung less, but the red blood cell. Arogya Vardhini cleans out your liver so that it's ready to take in whatever toxins that come in and efficiently move them out. And Amrita is another word for Guruchi, the vine that has that super immune boosting property. So actually, I think, it says as Anupanam. Anupanam is take along with. So if you take this liver cleanser with that. The other medicines you can ask about later and I will tell you about them, but I just want you all to know that I have been studying Rasa Oshadhis for the last, well, actually about 10 years. And I believe that they are some of the best medicines in the world. They have been used for 2,500 years. They were written into textbooks formally in the 8th century. So they've been used continuously for 1,200 years, and they are very effective for this series of things that's going on. In Paris, when I live in Paris, where one of my homes is, we are very careful about the foods we eat. And we just have one rule. You can have anything you want as long as you know the source of it. And we are very careful about when we eat it. So Madan mentioned the article on Kala Bhojanam. Kala, or Kala actually, is the time. And there's a lot of definitions of time. It's not just the time of the day, it's the time that you're not eating, which is the intermittent fasting. It's how long you take to eat. It's the time between meals. It's the time you take to prepare a meal and let it sit until you eat it. It's the time that you eat something and are allowed to have it as a leftover versus not. It's the time that something takes to be prepared and harvested, like 60-day rice not being good for the body because it's too heavy. So Kala talks about time in all of its aspects, and Bhojanam talks about meals. And in Paris, of all places, I find some of the best meals because they eat simply. The people that are doing Ayurveda, like my friend Caroline, who's a fantastic Ayurveda proponent, she just says, if we don't know where the food is made, don't eat it. And it really takes away